Osurnia is a polyvalent topical gel formulation for the treatment of acute otitis externa and acute exacerbations of recurrent otitis externa in dogs. It is approved at a dose of 2 1 ml applications 7 days apart. It contains the broad-spectrum antibiotic florfenicol, the antifungal terbinafine and the steroid betamethasone. It is important to note that the pharmacokinetics and pharmacodynamics of topical treatments are quite different from those following systemic administration. The gel formulation is absorbed and retained in the cerumen within the ear canal. The active ingredients therefore remain in the ear canal throughout the treatment period. The estimated mean half-lives are 15 days for florfenicol and 5 days for terbinafine. In contrast, the half-lives following systemic administration would be measured in hours. Selecting an appropriate topical treatment relies on the clinical signs and cytology. Erythroceruminous otitis, that is, a red, waxy and itchy ear, is usually associated with staphylococcal or Malassezia overgrowth, and other organisms such as gram-negative bacteria are much less common. In contrast, suppurative otitis, that is, a painful, ulcerated and purulent ear, is most commonly associated with Pseudomonas, and other gram-negative bacteria and gram-positive cocci are less common. Malassezia are rarely found in suppurative otitis. Cytology can easily, rapidly and reliably differentiate coccoid bacteria, rod bacteria and Malassezia. Bacterial culture can precisely identify the organisms, but the antimicrobial susceptibility results must be treated with caution. These are very poorly predictive of the response to topical treatment. This is because the breakpoints used to determine susceptibility and resistance are based on tissue levels following systemic treatment. They are in microgram per ml ranges. It is likely that local concentrations following topical therapy will be much higher than this. If culture results can't be relied on, clinicians need confidence that topical therapy will exceed the minimum inhibitory concentrations, the MICs, of the target organisms for the entire dosing interval. Studies with Osurnia show that the concentrations of terbinafine and florfenicol in the ear canals greatly exceed the MICs for common otic pathogens throughout the treatment period. Following the standard 2-dose protocol, florfenicol and terbinafine concentrations were at least 1,000 times the MICs for Staphylococcus pseudointermedius and Malassezia pachydermatis for 30 days. Similar results were seen with other staphylococci, including MRSP and MRSA, Streptococcus canis, Enterococci, E. coli and Proteus. The exception was Pseudomonas. Pseudomonas are largely resistant to chloramphenicals and, as expected, the MICs were very close to the florfenicol concentrations in the ear canals. Otitis externa is a painful disease. Owners can therefore find it difficult to consistently apply an appropriate dose, which can affect efficacy and animal welfare. In-clinic application of leave-in preparations greatly facilitates treatment. The tubes permit precise dosing with 1 ml. Clinic staff can quickly and effectively administer treatment, and, if necessary, sedation can be used. In one study, Osurnia was as effective as a daily product, but quality of life measures for the dogs and their owners were significantly higher. In conclusion, florfenicol and terbinafine are highly active against most of the bacteria and Malassezia seen in canine otitis. Therapeutic concentrations are achieved and maintained for at least 30 days after 2 administrations. In-clinic application and persistent activity greatly improves compliance and animal welfare.